Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele, presenting Health Equity Teacher Module, Transportation and Health. The objectives of this module is that by the end, learners will be able to do the following: list potential transportation barriers to accessing healthcare, describe epidemiology and risk factors associated with transportation barriers to healthcare, discuss the impact that transportation barriers can have on someone's health, and define telehealth and its impact on transportation barriers to healthcare. So to begin, let's just start by talking about what transportation barriers are. And here we apply them to healthcare because that's what we're focused on, but transportation barriers apply to things more than just healthcare. The main ones I have listed here, the one that you immediately think of is lack of vehicle access. This could be that the person doesn't have their own car, that they don't have access, continuous, stable access to the car of a family or friend. And just a fun fact with that, with vehicle access, is that bus users, so those that don't have vehicle access, are twice as likely to miss their appointments compared to car users. And that's important to keep in mind going forward. We'll talk more about the health impact of transportation barriers later, but in particular to lack of vehicle access, that just shows the importance of that barrier in respect to healthcare. Another transportation barrier is inadequate infrastructure. And so what this means is that locally or on a state level, there is inadequate infrastructure that prevents the individual from conveniently using transportation, whether it's public or private. And these could be inadequate roads or railways, so not having enough roads to get to the places you need to get to. Limited transit availability and routes, so whether there's public transportation, that's one thing, but whether that public transportation reaches the amount of people that need it is another thing, and gets them where they need to go. And then lastly, unsafe public transportation. So city or areas, public transportation systems may not be safe for the public to use, which would prevent or persuade the individuals to not use it and to not get where they need to go. Another transportation barrier is long distance and lengthy travel times. And as a concept, no one likes to have to drive a long distance to get where they need to go. But it's also extra problematic when these lengthy travel times are incompatible with someone's available time, whether it's their work schedule, whether they need to be somewhere for their kids or for their family. It's hard to try to get somewhere when it doesn't fit into the time that you have to get there. Another transportation barrier is cost of transportation. So whether you have your own car or are taking public transportation, it's expensive. If you have your own car, you have to pay for car insurance, gas, and maintenance of that car. Public transportation, there's transit fares, and while there are, you could buy in bulk or by month or by year for a lot of them to try to save money, it does add up when you're using it a lot. And lastly, a major transportation barrier are policies. And these could be local, state, or federal policies that lead to less public transportation, barriers to getting driver's licenses, and poor public transportation equity. So whether it's a bill that got passed to decrease funding for the city's public transportation, or whether there's new regulations on who can get a driver's license or what you need to get a driver's license. It's things like these, it's policies like these that can make it harder for someone to have freedom to their own transportation. So these are the major transportation barriers. There are more, but these are what come to mind when you think of what's preventing people from getting where they need to go. And what's important to recognize is that there are certain risk factors that have been seen to be associated with transportation barriers. The first is old age. So it is very common for when people get older, whether they lose the physical or cognitive ability to drive, whether their loved ones don't want them driving. As you get older, the amount of people that are driving usually decreases. Those people are more at risk for experiencing these transportation barriers because they are unable to own their own vehicle and drive their own vehicle. And so they're left to public transportation or the will of those people who are willing to drive them. Another transportation barrier risk factor is being less educated. Females are more likely than males to face transportation barriers, says the statistics. And being from ethnic minorities is also another risk factor for transportation barriers. So statistically, Hispanic populations have been found to experience the greatest transportation barriers, followed by African Americans, and then followed by whites. White populations have been found statistically to face the least transportation barriers. Having low income or low socioeconomic status is another major risk factor for transportation barriers. If you think back to the transportation barriers we just went through, you need money to own a car, you need money to maintain a car, you need money to use public transportation. And having a low income can prevent someone from having the financial means to get where they need to go. And then cyclically could exacerbate that low income if the place they need to get to is their job. Another major transportation barrier is having a high burden of disease. So it's found that people who have the highest burden of disease, whether it's physical or cognitive, they are more likely to face transportation barriers. And this could be because they are physically unable or it's harder for them to physically use transportation systems, whether it's private or public. And this could also be bidirectional, that because these people with high disease burdens aren't able to get places as easily, their health might take a hit because of this and exacerbate this high disease burden to worsen further. Lastly, another transportation barrier is being physically or cognitively unable to drive. So this is typically thought to be in association with older age, like I mentioned previously, but it is important to recognize that you don't have to be of old age to lose the physical and cognitive ability to drive. It could be due to certain disabilities or conditions that could happen at any age along the way. So don't automatically assume because someone is young and appears healthy that they are able to drive. Make sure to really get to know them and their abilities before determining what their transportation barriers might be. Now that we've thoroughly gone through transportation barriers, what they might be, and what might make people more at risk for having them, the next goal is to really discuss the impact of transportation barriers. And this is a truly unique impact because not only does it impact someone's health directly, but we also find that it impacts someone's health indirectly as well. And I'll get to that next. So here I have a sort of transportation mobility web. And it's this diagram that lays out what transportation mobility is required for. You know, it allows someone to go to the grocery store. It allows someone to go to their job, to school, to go do other shopping areas for clothes, for other things they might need. It allows people to visit family and friends. It allows them to go take care of themselves personally, hairdressers, nail care, barbershops, to get to recreational activities or volunteer service locations that they might be involved with. And the major focus of our presentation is that it allows them to go to the health appointments and treatment appointments that they are scheduled for. So whether this is a provider's office or a pharmacy, transportation is important for someone's health. And I think that one of our course resources materials said it best. So transportation is necessary to access goods, services, and activities such as emergency services, healthcare, adequate food and clothing, education, employment, and social activities. And why I love this web diagram so much is that it impacts so many areas of someone's life if they can't uh, have full access to transportation. Not only is their health directly impacted by being unable to attend their health appointments, but other social determinants of health are impacted by this social determinant of health. Without transportation, you might be more at risk for food insecurity because you can't get to the grocery store. Um, you might not be able to reliably get to your job, which would put you at a lower income, which is a major risk factor for a lot of the social determinants of health, food insecurity it being one of them. Um, and then not being able to reliably get to recreational activities, volunteer services, um, visiting your family and friends, school for kids, that's a major part of someone's mental and social well-being. So their physical health as well as their mental health and social well-being are all impacted by someone's access to transportation. So looking at the big picture, transportation is clearly important. Getting a little bit more zoomed in on someone's health, though, like I said earlier, that is the focus of this presentation, is transportation and health. We see that barriers to transportation are associated with decreased attendance to primary care, specialty care, and pharmacy appointments. We see statistically that it's estimated that 3.6 million Americans missed or delayed medical care because of lack of access to transportation, and that's yearly. Um, and we think of vulnerable populations that are especially affected by these social determinants of health, and we have children here. We have 3 million children in the US that miss a healthcare appointment each year due to unavailable transportation. And I thought that this statistic was pretty significant, that a person could miss their health appointment for a variety of reasons, but studies find that half of patients report that the reason for missing their appointment was due to transportation barrier, which is just crazy to think that something that we think of being so simple maybe is getting in the way of someone's health so significantly. And these decreased attendances to these health appointments and to pharmacies leads to delays in clinical interventions. So delays in treatment, lack of appropriate treatment, chronic disease exacerbations, and unmet healthcare needs. Because these patients aren't getting where they need to go, they're unable to adhere to their treatment plans. Their diseases aren't being treated adequately, and they get worse. And if patients have new conditions arise and aren't going to their health appointments, these are new unmet healthcare needs that no one knows of and that are just affecting the patient without any care for them. Clearly, there's a significant relationship between transportation and health, and that without transportation, someone's health is very much at risk for worsening and for being neglected. So I'd like to finish with a point on telehealth. And this is something that we've seen explode since the beginning of the COVID pandemic. While the concept wasn't new with the COVID pandemic, it became a lot more popular. So telehealth is defined as the distribution of health-related services and information via electronic information and telecommunication strategies. This can be via phone call appointments or video call appointments. But telehealth really enables patients to see their providers without having to leave their home or wherever they might be. This cuts down on travel time. It allows patients to actually get the healthcare attention that they need, even though they might be facing transportation barriers. It's associated with similar or increased levels of patient satisfaction with their care, reduced caregiver burden and travel costs for patients because they're not having to go anywhere. And significantly, we see lower no-show rates with telehealth in comparison to in-office visits. We have a no-show rate of only 7.5% of appointments were no-shows with telehealth appointments, and that's compared to 36.1% of in-person visits during COVID and 29.8% of in-person visits before COVID. So we see a dramatic reduction in no-show rates with telehealth, which is awesome. We have these technologies that can allow us to overcome transportation barriers. That being said, with that success, there are always problems and with new interventions, and one of them being is that not everyone has reliable access to internet and stable, reliable connection with internet. So that could put them at a lower ability to utilize telehealth. Video quality is not always the best with telehealth, and that can impede the care that's being given via telehealth, as well as policy-wise and medical insurance-wise, there has been differences in provider reimbursement rates between telehealth and in-office visits that there has been some recent acts and laws, especially with COVID, that have been trying to overcome those reimbursement rates because it benefits, it can benefit the patient if you can overcome these transportation barriers. But differences in reimbursement rates still do exist. So that is another potential problem with it. But what's important with telehealth is that it is a window, it is a way that we can overcome transportation barriers, and we'll talk a little bit more about it when we get to our presentation on assessing and addressing transportation barriers. But this concludes our presentation on transportation barriers in health, and I hope that you've recognized what transportation barriers are, what the risk factors and epidemiology for transportation barriers might be, and how transportation barriers not only impede someone from getting to their providers, but also indirectly affects the patient's health by impeding them from getting other places as well. All right, that concludes our presentation on transportation barriers in health. We'll see you in the next presentation on transportation barriers, how to address and assess them. Thank you.